physiotherapist. Today I'd like to talk to you about the difference between the RICE principle and police principle with regards to post-acute sprains and strains, essentially. So the RICE principle, what that refers to is rest, ice, compression, and elevation. And so there's a bit of controversy about the RICE principle, and the reason for that is, first of all, the evidence doesn't necessarily suggest that the RICE principle is really effective for post-injuries. And also, for some clinicians, they feel that putting the ice and resting it initially can actually inhibit the natural healing process in which essentially blood flow is sent to an injured area. And the other sort of controversy with it is actually resting it and the effect that prolonged rest can have on an injured area in terms of, again, the increase in swelling, the limitation in terms of mobility, and the potential for atrophy of certain muscles that surround the joint. So basically a loss of muscle mass. So a lot of physical therapists now are moving towards, it's referred to as the police principle. And it's just slightly different, again, from the RICE principle in terms of so first of all, the P, that stands for protection. So initially after an injury, we're going to want to protect that particular joint. The OL refers to as optimal loading. And this is really, I think, the key difference in terms of these two different areas. So with optimal loading, the idea is that we want to try and maintain as much mobility, range of motion as pain allows, right? So the idea here, so for example, if you have an ankle sprain, is that those first few days after that particular injury is to try to maximize, right, with this optimal loading, the amount of movement. And this might be some non-weight bearing, just some ankle pumps, for example, non-weight bearing, just to try to, again, reduce the effect that the swelling will have in terms of joint mobility and strength, and to try to also kind of flush out, right, to some degree, some of this increased edema and swelling within the area. So again, that's the O and the L. The I, again, is the ICE principle, and then compression and elevation. So compressing the joint, essentially using some sort of a tensor bandage, for example, again, the ankle sprain example, and elevating the leg to, again, try to draw out some of that swelling. Now, the reason I have sort of a bias, again, towards the police principle in this case is if we go back again to that ankle example, what we're really trying to also achieve by getting some of the optimal mobility and movement in through the ankle is to actually reduce the risk of a DVT, which is referred to as a deep vein thrombosis. So essentially, we don't want any blood clots to form as a result of this lack of mobility. So again, that's where my bias tends to be. I have had patients in the past who, as a result of this lack of mobility in an area, particularly the calf or in the ankle, with biasing, this sort of resting, not moving, that they were actually at risk for a DVT, and some have actually had these DVTs, and again, as a result of that, it's created all sorts of different complications as a result of these blood clots. So again, my bias is towards the police principle, to try to, again, get the mobility, get the strength back. Using pain, I always say this to patients, right? Using pain as your guide, which is, again, is really key, and making sure it's the right type of movement. So for a lot of individuals, you're not going to want to weight bear right away, especially something like an ankle sprain, but something, again, where it's non-weight bearing, gentle movement, getting the blood flow going, trying to reduce swelling as a result of the movement, I think is sort of the ideal approach after these acute ankle or other areas in terms of these acute ankle sprains and strains. Thanks again for watching. I really appreciate it. Have a great day. Take care.